I want to be very clear about something before I say anything else in this video. I am not here to tell you that doctors are bad, or that the medical system is hiding things from you, or that there is some suppressed cure that nobody wants you to know about. That is not what this video is. I have enormous respect for physicians and for the work they do. But I have also sat in enough doctors' offices with my patients, listened to enough of what they were told and what they were not told, and worked with enough older adults who walked away from a medical appointment more confused than when they arrived, to know that there is a real and significant gap between what medicine can offer and what medicine typically delivers in a 15-minute appointment when the subject is swollen legs. My name is Sandra Whitmore. I am a certified physical therapist with more than 20 years of experience working with people over 60 on circulation and mobility. And today I want to fill in some of that gap. I want to tell you things that are true, things that are evidence-based, things that your doctor almost certainly knows, but that there simply may not have been time or occasion to explain to you in the context of your appointments. Let me start with the most important thing, the thing I wish someone had communicated clearly to every person over 60 who has ever been told their swollen ankles are just something that happens at your age. Swollen legs are not a diagnosis. They are a symptom, and a symptom has causes, and causes have solutions. The goal of medicine is to identify the cause and address it. When swollen legs get dismissed as just part of aging, what is actually happening is that the identification step is being skipped, and therefore the solution step never happens. The person goes home with their swollen legs, no better informed, no better equipped, and no closer to understanding what is actually going on. So let me tell you what is actually going on. There are several different mechanisms that can cause leg swelling in people over 60, and they are not all the same, and they do not all have the same solution. Understanding which mechanism is driving your particular swelling is the key to knowing what will actually help. The most common mechanism, the one responsible for the vast majority of what I see in my practice, is chronic venous insufficiency. This is a condition in which the veins in your legs, specifically the one-way valves inside those veins, are not functioning as efficiently as they should. The valves are supposed to prevent blood from falling back down toward your feet between heartbeats. When they are working properly, blood flows steadily upward through a series of valve segments, each one closing behind the blood as it passes through. When the valves weaken or when prolonged inactivity reduces the muscular pressure that helps them work, blood begins to pool below the weakened valves. Pressure in the veins increases. Fluid leaks through the vein walls into the surrounding tissue, and your ankles swell. This is, fundamentally, a mechanical problem with a mechanical solution. The solution is to restore the muscular action that helps those valves function. Specifically, by activating the calf muscles, which are the primary drivers of venous return in the lower leg, through targeted exercise. I have been teaching this for 20 years. The research supports it unambiguously. And yet it is one of the most underexplained interventions in outpatient medicine, because 15 minutes is not enough time to teach it properly, and because prescribing exercise does not have the same procedural billing code as prescribing medication. The second mechanism is lymphatic congestion. Your lymphatic system is a parallel drainage network that runs alongside your vascular system. It collects excess fluid from your tissues and returns it to your bloodstream. Unlike the blood, which has the heart to pump it, lymphatic fluid has no dedicated pump. It relies entirely on the contraction of surrounding muscles and on the rhythmic compression of the tissues to move forward through the lymphatic vessels. When you are sedentary, lymphatic drainage slows. Fluid accumulates in the tissue. This contributes to swelling that has a different quality from venous edema. Lymphatic congestion tends to feel more solid, more fibrous than the soft, pitting edema of venous insufficiency. It also tends to affect the foot and lower leg more diffusely, rather than concentrating primarily at the ankle. The solution for lymphatic congestion is also movement, but with a slightly different emphasis. The lymphatic system responds particularly well to gentle, rhythmic compressions through the tissue, which is why massage and elevation are helpful for lymphatic swelling in ways they are only partially helpful for venous swelling. Combining movement with manual compression techniques, which I will describe later in this video, addresses both systems simultaneously. The third mechanism is medication-related edema. A number of commonly prescribed medications cause leg swelling as a side effect. Calcium channel blockers, which are widely used for blood pressure management, are among the most common culprits. Certain anti-inflammatory medications, hormonal therapies, and diabetes medications can also cause fluid retention in the lower extremities. If your leg swelling began or worsened after starting a new medication, that connection is worth exploring with your prescribing physician. This is not a reason to stop taking a medication without guidance, but it is absolutely a reason to have a conversation. I tell every one of my patients to bring a medication list to their appointments and specifically to ask whether any of their current medications has fluid retention or lower extremity edema as a known side effect. Surprisingly often, the answer is yes, and sometimes adjusting a medication or switching to a different agent in the same class resolves the swelling entirely. I had a patient named Barbara, 69 years old, who had been dealing with progressive ankle swelling for 2 years. Her doctor had attributed it to venous insufficiency and recommended compression stockings. The stockings helped somewhat, but did not resolve the problem. When I reviewed her medication list, I noticed she had started a calcium channel blocker about 2 years and 3 months before the swelling began. I suggested she ask her cardiologist whether a different antihypertensive might be worth trying. He switched her to a different class of medication. Within 6 weeks, Barbara's ankle swelling had reduced by roughly 60%. The remaining swelling was genuine venous insufficiency, which we addressed with exercise. But the medication had been amplifying the problem substantially, and nobody had made the connection. So here is what I want you to take away from the first part of this video. If you have swollen legs and you have been told it is just part of aging, I want you to ask a different question at your next appointment. Not just, is this serious? But what is causing this specifically? And what is the most effective thing I can do about it given the likely cause? Because the answer to that second question is almost always more specific and more actionable than just keep moving or try compression stockings. Now let me get into what I actually teach my patients to do. And I want to start with something that almost no one in the conventional medical world takes the time to explain, which is the profound importance of the sitting position itself. When you sit in a standard chair with your feet on the floor, your legs are in what we call the dependent position, meaning they are hanging below the level of your heart. Gravity is working against your venous return. Every minute you spend in this position is a minute during which blood and lymphatic fluid are being pulled downward into your lower legs by gravity, and your circulatory system is working against that pull to move fluid back up. Now, there is nothing inherently wrong with sitting. We all sit. We have to sit. The problem is sitting without any interruption of that dependent position for extended periods. Because the primary mechanism that offsets the gravitational pull, the calf muscle pump, only works when those muscles are contracting. And when you are sitting still, they are not contracting. The first and most powerful intervention I teach is not an exercise at all. It is a positioning strategy. I want you to think about creating what I call elevation windows throughout your day. An elevation window is a period of 10 to 15 minutes during which you deliberately raise your legs above the level of your heart. You can do this in a recliner, on a couch with your legs up on the armrest, on your bed with pillows under your calves, or in any position that gets your feet higher than your chest. During these elevation windows, gravity shifts from enemy to ally. Fluid that has been pooling in your lower legs starts to flow back toward your central circulation. The pressure in your veins decreases. The tissue fluid that has been accumulating in your ankle region begins to reabsorb. If you do this consistently, twice a day, once in the afternoon when swelling tends to peak, and once in the evening before bed, you will notice a measurable difference in how your legs look and feel within 1 to 2 weeks. But here is the piece that medicine almost never adds, and this is important. Do not just lie there passively during your elevation windows. Use them, because the combination of elevation plus active calf muscle contraction is dramatically more effective than either one alone. Gravity is already helping you move fluid upward. You add muscular pumping to that, and you get a synergistic effect that neither approach produces on its own. So during your elevation windows, do ankle pumps. Flex your feet up and down, 10 to 20 repetitions every few minutes. Do ankle circles. Do toe curls and spreads. Keep the muscles active while the position is working in your favor. I taught this to a patient named Dorothy, 74 years old, who had been dealing with significant lower leg swelling for 3 years. She had tried compression stockings, which helped, but which she found uncomfortable in summer. She had tried dietary changes. She had reduced her sodium intake. None of it had made the difference she was hoping for. When I introduced her to the twice-daily elevation windows with active exercises, she called me at the end of the second week and said something I found genuinely moving. She said, "Sandra, my ankles look like they did 10 years ago. I looked at them this morning and I almost did not recognize them." That is what the right combination of interventions can do. Not miracle results that defy physiology, but results that are entirely consistent with physiology and that are simply not being communicated to most of the people who need them. The second major intervention I want to describe is what I call the compression sequence, which addresses lymphatic congestion specifically. This is a self-massage technique that you can do at home without any special equipment in about 5 minutes per leg. You sit comfortably with the leg you are working on slightly elevated if possible. Starting at your upper thigh, you apply gentle but firm pressure with both hands in a scooping motion, moving from the inner thigh outward and downward toward the knee. Then you work from the knee down the calf, again using a gentle scooping pressure directed upward from ankle toward knee. Finally, you work from the ankle to the foot, pressing firmly along the inner arch and across the sole. The direction matters. You are always moving from distal toward proximal, from foot toward heart. You are mimicking the direction that the lymphatic system needs fluid to travel. The pressure should be firm enough to feel, but gentle enough that it does not cause pain or leave marks on the skin. Dorothy added the compression sequence to her evening routine after the 3rd week of working with me, and she told me it was the component that made the biggest difference for the residual swelling that the elevation windows had not fully resolved. She said it felt like she was actively draining her own legs. That is precisely what she was doing. Let me now give you a complete daily protocol that combines the elevation windows, the active exercises, and the compression sequence into something practical and sustainable. Morning, before the day's sitting begins. From bed or immediately after rising, do 20 ankle pumps in each direction, 10 ankle circles on each foot, and 15 seated heel raises. Total time, 3 minutes. Mid-morning, after your first hour of sitting. 20 ankle pumps, 1 minute, that is all. Afternoon, ideally between 2 and 4, when venous pooling and lymphatic congestion peak. Elevation window of 10 to 15 minutes. During the window, do 2 sets of 20 ankle pumps, 1 set of 15 heel raises, and 1 set of ankle circles. Total time including elevation, 15 to 18 minutes. Evening, after dinner or before bed. Compression sequence on both legs, 5 minutes per leg. Follow with another set of ankle pumps and ankle circles. Final elevation of 10 minutes if possible. This protocol, done consistently, addresses venous insufficiency, lymphatic congestion, and the mechanical effects of prolonged sitting in a comprehensive way. It does not require any equipment. It does not require any fitness level. It requires only understanding why it works and the discipline to do it. I want to take a moment to talk about what happens when people follow this protocol consistently over time, because the trajectory matters as much as the starting point. In the first week, most people notice that their evening swelling is somewhat reduced compared to before. The elevation windows and the active exercises are beginning to shift the daily fluid balance. The change is often subtle enough that the person notices it but might not be sure whether to attribute it to the protocol or to natural variation. I encourage my patients to trust what they are seeing and to keep going. In the second and third weeks, the changes become more consistent and more pronounced. People report that their ankles look different in the morning, starting the day with less residual fluid than before. They report that the afternoon heaviness, that leaden feeling in the lower legs that so many older adults accept as normal, is less severe. Some people report that their shoes feel looser at the end of the day, which means their foot and ankle tissue is retaining less fluid. By the 4th to 6th week, most patients have reached a new baseline. Their legs are not what they were at 40. But they are meaningfully better than they were 6 weeks ago. And more importantly, they are better in a way that the person controls. They understand what produces the improvement and what erodes it. They know that a day of too much sitting without the protocol will bring back some of the swelling. They know that a week of consistent protocol will reduce it again. That knowledge is itself a form of power. Barbara, the patient I mentioned earlier whose calcium channel blocker had been amplifying her venous insufficiency, reached her 6-week milestone and called me on a Tuesday afternoon. She said, "Sandra, I want you to know that I put on a pair of shoes this morning that I have not been able to wear for 2 years. They fit." She sounded like she could not quite believe it. I told her I believed it completely, because I had watched it happen with enough patience to know that it is not remarkable. It is expected when the right interventions are applied consistently. I want to close this video by returning to what I said at the beginning. I am not here to tell you that doctors are withholding things from you. Most physicians are doing the best they can within the constraints of the system they practice in. But I am here to tell you that the best available information about managing swollen legs after 60 is more detailed, more actionable, and more effective than what most people hear in a standard appointment. You deserve to know the specific mechanism causing your swelling. You deserve to know the specific interventions that address that mechanism. And you deserve to know that meaningful improvement is possible at any age, for almost anyone with the right approach. You can do this from your couch, no excuses. 5 minutes a day changes everything for your legs. I am Sandra Whitmore. Thank you for watching, and I will see you in the next video.